Battle stands for healthcare. I'm joined by Jeff Miles. He's the president of Jeff Miles Organization, which works with companies to provide customized health insurance plans. David Drucker is a political reporter for Roll Call, and Republican Congressman Scott Garrett of New Jersey, who is a member of the House Financial Services Committee. Good morning, gentlemen. Congressman Garrett, I have to say, I don't know. I mean, I've been covering this thing for 5 months, and I'm confused every single day. There's another change. What's going on now with the House bill?
Well, if you're confused, just imagine how the American public is, that they're equally, if more so, confused, because every day we hear different stories coming out of the Senate, coming out of the House, and of course when the President says one thing during his little somewhat State of the Union type address he gave a couple weeks ago, and the bills that we have to consider in the House are absolutely nothing like what he's talking about, everyone is confused. And so at the end of the day, really what needs to be done is to, as Hillary Clinton said about other foreign policy, push the reset button and go back to square one, and let's start over and let's clarify what we're dealing with here.
David, is that what we need to do, is to push the reset button, or do we need to figure out a way to explain to the American people what the difference is between the House and the Senate options?
Well, I think that depends who you are. Obviously, if you're a Democrat on the Hill, at least a liberal Democrat and part of the Democratic leadership, you'd like to try and find a way to explain what you're trying to do with health care reform in a way that people are going to like it. You know, the problem is that every bill we've seen so far, save for the Baucus bill, has been slammed. And the Baucus bill, while not slammed by the public, has been slammed by many Democrats on both sides of Capitol Hill. Republicans have made the argument that the problem isn't that we don't need health care reform. The problem is the way the Democrats have gone about it is not going to accomplish the necessary goals, and is going to make a bigger mess of the health care system, which is why I think, and obviously the congressman can speak for himself, but why I think they would like to reset this whole effort. It just depends on who you are, how you proceed from here.
Jeff, here's the thing. I wake up this morning and I say to myself, every single detail that I've heard about Max Baucus's bill never included a public option. It was not an option on the table because Blue Dog Democrats were not going to support it, nor could they get any Republicans to cross the aisle. Now we hear that an amendment may work its way in and become a public option as a part of the bill. What's going on?
Well, Alexis, you know, I don't have to be as tactful as the congressman does. I can tell you this pretty simply and straightforwardly. The Baucus bill is the single worst piece of health care legislation that has ever been introduced in the Congress. By far, it is the worst bill. It has built-in rationing. It has a built-in middle-class tax increase that is very large. It has a built-in penalty for the people who are the biggest supporters of the president, the young, who are really going to pay, young working people who are really going to pay a lot in taxes and in premiums. This is the worst bill that has yet to be produced. I do think it's time to push the reset button.
Okay, but Jeff, I got to play devil's advocate for you for just a moment here. He's accepted, Senator Baucus, granted not a lot of Republican support, but he sat there among the Gang of Six for many months, addressing things like selling insurance across state lines. Yes, we're not getting it tomorrow, but I believe it's 2015. Talking about cutting back some of those commitments that you have to take health care and cutting it down, I believe, from, I don't know, was it 3,600 or 3,800 down to 1,900? I mean, there have been concessions along the way, have there not?
Well, there have been some, but still, fundamentally, the legislation is as flawed as a flawed piece of legislation can be. There is just no way for it to work. It's not being honest with the American people. It's taken some of the exact same issues that the American people don't like and repackaged them using different words to describe them. Alexis, I know you've talked a lot about about buying across state lines here. But, you know, there are a lot of problems with selling insurance across state lines. It's not as simple as it sounds because there's really no regulatory mechanism in effect. It's a consumer protection problem.
But Congressman Garrett, last I saw, and believe me, I think I'm as confused as anybody. I've been reading about this nonstop. Didn't Senator Max Baucus's bill get the best performance card? I don't know if it was from the CBO or the OMB. I apologize right now in terms of the price on it.
Well, that may be true, but the bar is that you're setting is pretty low, that as far, or high as the case may be, you want to look at as far as what the best is. I mean, we're talking about initially $1 trillion, so he's coming underneath that. Well, big deal, because no one really believes that those numbers are going to hold, that going forward, Congress is not going to be, in Washington is not going to be responsible on trying to rein in and keep health care costs down. And I'll give you one recent example, what we just did in Congress yesterday. Yesterday we had a Medicare bill come up before the floor, and we had the opportunity to say we're going to rein in the expenses of Medicare, and what did we do? We went 180 degrees the other direction and said we're going to spend even more. We're going to take money that's supposed to be setting aside for people in future generations and using it today for purely political purposes. You know, even Steny Hoyer came on the floor and said it was a bad bill. I voted along with Steny, which is sort of a bipartisan thing you probably don't normally see. So the bottom line here is that you can't, the public out there looking at this saying, is Congress going to be responsible on keeping the cost down? Well, they sure weren't yesterday, and I doubt they're going to be on any $1 trillion bill that we're looking at today as well.
David, I don't understand where this is going. I don't see resolution unless the Democrats are ready to go it alone.
Yeah, well, don't feel bad, because most people don't understand where it's going. Look, the Democrats need to stop fighting amongst themselves and figure out what they want to do. You still have a block of conservative and moderate Democrats, both in the Senate and the House, that don't want to do what the liberal Democrats in the Senate and the House want to do. The Democratic leadership and the president are not in line with the moderate and conservative Democrats. And it's until they stop fighting about the cost of the bill, about the public option versus the co-op, and many other things, you're not going to see this thing get to any sort of unanimous agreement and move forward, because Democrats really have all the numbers here. And just one quick thing on the public option and the Baucus bill I should point out, we really don't expect that amendment to pass.